doctors say your health is your wealth, you are what you eat. Well, you definitely are what you drink, what you breathe, and where you live. All impacts your health. So if you live in a polluted area, say Flint, Michigan, which we're all familiar with, and you drink lead contaminated water, you will in fact get lead poisoning. Lead in the water is a form of pollution and it has medical consequences. And this concept goes along with any form of pollution, whether you're breathing it, eating it, or taking a medication we called with a pollutant in it. So, what is a pollutant? Simply put, it's an environmental contaminant and it has hazardous effects on the human body. How important is it that we understand the effects of pollution? Well, I'll give you some context. And I always state this study because it's a pretty eye-opening study done from Lancet, a very prestigious journal. It shows that 9.9 million people every year die from a pollution-related illness globally. That's 1 out of every 6 people. Again, I'll say it, 1 out of every 6 people on the planet die of a pollution-related illness. It's more than all car accidents, suicides, homicides, and wars combined. Um, so pretty important stats I would consider. So let's talk about coal since we gave you that little opener. And for purposes of context, I want everyone to think about the burning of coal, the breathing in of coal, the same way you would think about smoking cigarettes. Smoking cigarettes, as we know, is a pollutant. These toxic compounds, very similar to the toxic compounds found in cigarettes, have main effects on our respiratory tract because that's where we take in the hazardous compounds. They can cause things like increased respiratory infections, wheezing, chest tightness, emphysema, asthma, all of which increase ER visits and hospital admissions. And of course, children, African Americans, and the elderly are more susceptible and more affected. What else does coal do? It decreases exercise tolerance with just 15 to 10 minutes of exposure. So if you've had problems depending on where you were jogging outside in one place in a state that's closer to a coal plant, you might experience less and decreased exercise intolerance. Excuse me. Coal-related pollution also increases your risk of heart attacks, strokes, lung cancer, the top 3 killers in this country. And how does it do this? It mainly enters the body through the lungs, just like cigarette smoke, and actually just like COVID-19. And what's really interesting is if you stretch out the adult human lung, it would roughly cover the full size of a tennis court. And that allows us to breathe in thousands of gallons of air each day, making it really the greatest potential source of toxic exposure known to humankind. And our lungs are basically a huge filter. So we are, in fact, smoking this air, filtering it, absorbing whatever is in it. And in addition to that, some of the chemicals found in coal can even increase behavioral disorders in infants and children. Coal leads to premature death, higher infant mortality. One of the biggest studies that looked at uh, people living in close proximity to coal reviewed about 113 peer-reviewed journals over the last 30 years and found that those living closer to coal plants had higher death rates and death at earlier ages, mainly from respiratory tract infections, emphysema, lung cancer, cardiovascular diseases, and some other health problems. Also, people living closer to coal plants have been found to suffer 2 to 5 times the health impacts of people living further away. This was particularly shown in Baltimore. I know you saw all those plants that Rosa showed, and they did a study in 2010 that pretty much showed that Baltimore had the highest mortality rate from air pollution in the country. This was even more than LA and New York City. Another interesting health stat is in general, when we look at asthma, it typically affects 1 out of 24 people, but if you live closer to a coal plant, it affects 1 out of every 4 people. And as I've said, this is something that affects more um, young, old, African American people of color. Uh, President Sweat will likely state some statistics, but an NAACP study stated that race, even more than class, is the number one indicator of the placement of these toxic facilities in our country, which is why a lot of the data shows that the Black population suffers disproportionately, with 5 times many more visits to the ER, 3 times more hospitalizations, and 2.5 more premature deaths than we see in the white population. And this is also due to the fact that about 70% of the African American community lives within 30 miles of coal. So, in summary, as we've seen with COVID uh, and other pandemics and other health issues, the health of our community and planet on which we all depend on is deteriorating at a very rapid pace, in part by many things, but one major contributor is coal. And what we are doing is eroding our very foundations of our livelihoods, our economies, our food security, our job security, our health and quality of life. But it's never too late to repair and sustain if we act now in these type of transformative ways. Thank you.